Hello guys, welcome back to US Healthcare Academy. Guys, in today's video, I'm going to take you guys through Loop 2300 and all the information that goes in Loop 2300. There's a lot of information actually that goes in Loop 2300. Loop 2300 is generally known as claim level. So basically all the information that is common to that claim goes on the claim level, and loop 2400 is known as line level or line item level, which means that on one claim maybe there are 5 services that are provided. So that service related information, it will go in loop 2400. So we'll see that in our upcoming videos. Yeah, but let's concentrate on loop 2300 for now. So loop 2300, uh, you can read this. So the developers of this implementation guide, they advise that we limit the number of claims between the ST-SE segment to 5,000 claims. There is no such recommendation limit to the number of ST-SE transaction. So there can be multiple ST-SE segments. Okay, for example, this is ST segment, so this is transaction set header, so start of this transaction basically, and between one ST-SE segment, so if you see this EDI file, this is ST segment, and for example we have just taken one claim here right now, but there can be multiple claims between an ST-SE segment, and what the implementers or the developers advise is that we keep the number to 5,000 claims, but it's not necessary. You can work with your trading partner. Trading partner means like the clearinghouse, because clearinghouse is the middleman. So before your claim, you send it to the payer. They actually go to the clearinghouse where they are segregated and sent to different payers. They are validated. So you can set higher limits with your clearinghouse. That is all that it says. So let's jump into CLM segment. Now CLM segment first element, which is also called as patient control number, is nothing but the claim number. So this claim number is assigned by the system which generates this, in which the claims are entered basically. So it can be a practice management or revenue cycle management system. So that this number is unique to only that system. Remember that, guys. And then the CLM02 contains the total charge amount. So whatever the total charge amount is, as I told you, that suppose there are 5 services provided on the claim, each service is for $100, so total charge amount $500 will be the total charge amount. And then 3, 4, 5, this to 5, okay, these are blank, and then 5 is a composite element. By what I mean by that is, if you see, the delimiter is not asterisk. If you see, there are 3 values. Let me just zoom in. See, 11 colon B colon 1. So this is also called as subcomponent separator. So if you want to create a composite element, so basically this element contains 3 data points. One is 11, one is B, one is 1. Let's look at it. Let's look at what each and everything means. Let me just zoom out. Okay. So CLM05-1, that means first sub element of 5th element of the CLM segment, which is place of service code. And in this case it is 11. I think 11 is for office visit. So you can go to Google and check what are the different place of service codes. Let's check that right now. So guys, here are the place of service codes, and this is from CMS. So 1 is for pharmacy, 2 is for telehealth provided other than inpatient's home, 3 is for school, 4 for homeless shelter. Let's see what is 11 for. 11 is for office. So yeah, as I said, office visit. 12, if the service was rendered at your home, then it will be home. So yeah, there are a lot of place of service codes. You can just Google it. 21 for inpatient hospital, 23 for emergency room, birthing center. Yeah. So that is what the place of service code means. Moving ahead, second sub-element of the fifth element of the CLM segment, which is the facility code qualifier. So B is for professional or dental services. Third element, which is the claim frequency code. This is also known as a resubmission code, but yeah, in our EDI language, it's called claim frequency code. And what that means is there are different values. Like one stands for admit through discharge claim, which also means that this is an original claim, like this sent for the first time. Uh, 7 means that suppose replacement of prior claim. So suppose there are some changes that you need to make on the claim. So and you think there are a lot. So instead of changing something on that, or suppose you already got paid for that claim, and then you think that, hey, I think uh, one service line is entered in mistake, or some information is entered in mistake, and you want to send a replacement of that claim. So you need to send value 7 here. So payer understands, okay, this is a replacement of the prior claim, and then whatever adjustments are supposed to be made, they adjudicate it in that way. 8 is void and cancel of prior claim. That means if the claim was entered in error maybe, or altogether sent to a wrong payer, suppose, and then you completely want to void that claim, like cancel it, then you send value 8, and the payer knows that, okay, so this claim no more stands valid, and yeah. So CLM 06 provider or supplier signature indicator, default is Y. So this is nothing but just is the signature of the provider. So Y just means that, yeah, signature on file. Assignment or plan participation code is again default to Y. That means you will accept the assignment. I mean, you will accept the payer on behalf. You'll accept the payment that the payer is making as per the contract. So it's just by that I abide by the contract. As simple as that. Assignment or plan participation code. Uh, Benefits assignment certification indicator also default to Y. Release of information code again Y. Patient signature code P. P indicates signature generated by provider because the patient was not physically present for the service. And then comes CLM 11. Again, this is a composite segment. So it also consists of 1, 2, 3, 4, and 5 sub elements. Let's go through each of them. So related causes code. So basically the condition that you're in now, is it related to auto accident that you met with, you had a car accident? Is it related to something happened at the place of employment, or it's some kind of other accident? So whatever it is, this is, as per that you will enter the value, else it can be blank as well. CLM 11-2. So this is also the same. It's just that you know if it is auto accident or other accident, then it is this those values A and OA goes into CLM 11-1. But if it is employment related condition, then it will output here in CLM 11th element, second sub element. CLM 11 third element is not required. CLM 11-4. So basically, if it's an auto accident, so anywhere in CLM1 or 11-1 or 11-2, if it's an auto accident, the state must exist. So the state code goes here in CLM 11-4. Country code, uh, again, it's blank, not required. CLM 12 is for some special program indicator. So Medicaid has a lot of special programs under which it offers coverage. So these are the codes. 02 is for physically handicapped children's program. This is one of the program. Special federal funding. So 03 is for that. 05 is for disability. 09 is for the second opinion or surgery. So as it says here, only output this element if billing Medicaid. So this is only required for Medicaid, the special program indicator. That was about CLM segment. Now under CLM segment, there can be a lot of DTP segments. Let's look at the EDI file structure. So if you see, where is our CLM segment? Asterisks here. All right. So under CLM segment here, there can be a lot of DTP segments. Like see, you see this DTP segment, but this is part of loop 2400 and not part of loop 2300. So let's look at what all DTP segments. DTP segments are basically all dates. All the required dates, if any, if applicable, it outputs into DTP segment. So first date is onset or current symptoms or illness. What this means is, so onset means when it actually started. So suppose you go to the doctor and you tell them about the current symptoms. So simple question, from since when are you experiencing these symptoms? That's the date that goes here. Okay. And you will see a lot of DTP segments, but there are different qualifier like this 431. 431 specially means that this is the date that follows that is onset or current symptoms or illness. In same manner, next TTP segment, but this is for initial treatment. So this is required when the initial treatment date is known to impact adjudication for claims involving spinal manipulation, physical therapy, occupational therapy, speech language, pathology, dialysis, optical refractions, or pregnancy. So for that, this initial treatment date is required for claims in involving the services. And again, the qualifier is 454. Third, last visit or consultation date, qualifier 304, required when the claim involves services for routine foot care and it is known to impact the payer's adjudication. So if you are going for routine foot care, then what was your last consultation or visit date, that is documented here. Qualifier 304. DTP qualifier 453 is for acute manifestation of a chronic condition. So here it says required when loop 2300 CR208 is A or M. So A means acute condition and M means manifestation of chronic condition. So yeah, CR2 is a different segment altogether. We'll look at it later, but this is a situational rule for this to output. So it's only required when loop 2300 segment CR2 element 08 has A or M in it. Yeah, let's actually have a look at it right now. CR2 asterisk. Okay. So CR208 nature of condition code. So A, if it is acute condition, or M, if it is acute manifestation of a chronic condition. In that situation, our manifestation date is required. So these are how rules are defined, guys. Uh, okay, let's move ahead. DTP 454, this is accident date, and we saw in loop CLM, in loop 2300 segment CLM 11-1, which is a composite element here. So if it's so basically what this rule means is that it is required when CLM 11-1 or 11-2 has an auto accident or other accident, then this accident date is required. And even if it has EM, which is condition related to employment, but it is the result of an accident, then this accident date is required. And okay, last X-ray date, qualifier 455, segment name DTP, loop 2300. Required when claim involves spinal manipulation and an X-ray was taken. So pretty simple. Whichever claims which requires an X-ray to be taken, or it has radiology services on it, radiology services are billed, then this X-ray date is required. Okay, this is for DT. This for disability dates. So again, it's DTP segment. Qualifier is 360, and then the disability date is mentioned here. Uh, so basically, you can send only from date, disability from, or disability to, till date, or you can send both like this. The only difference is the qualifier will change. It will change to 314, which says that we are sending the from and to date. And instead of D8, which is a format of CCYYMMDD, the qualifier now changes to RD8, which means the format will be CCYYMMDD dash CCYYMMDD. That's the only difference. Uh, Admission date, qualifier 435, is required on all ambulance claims when the patient was known to be admitted to the hospital, or required on all claims involving inpatient medical visits. So simple as that. If there is an admission involved, this admission date is will output here. And lastly, for loop 2300, the last DTP segment with qualifier 096 is for the discharge date. All right, guys. So that was it about CLM segment loop 2300, and we went through all the date fields and all the important information like place of service codes and claim frequency codes, etc. Let me know if you guys have any questions. You can put it in the comment box. Stay tuned for my next video. Till then, you guys have a good day. Take care. Bye bye.